Okay, now let's talk about another approach to postmodern approach to therapy, which is known as narrative therapy. Narrative therapy was developed during 1970s and 80s by an Australian social worker whose name was Michael White and David Epstein, who was from New Zealand. These two pioneers played a key role in the development of this therapy. Before we talk in detail about this narrative therapy, uh, I want you to pause this video and do a little exercise. Grab a pen and paper and write a story. You may be wondering what story? Think about if you have to turn your life into a story, what would that be? How that story would look like? What title would you choose for that story? What chapters would you include in that story? It may seem like a big task, but I want to keep it simple. So what you can do, just write 2, 3, 4 pages of story of yours. Uh, and then by the end of this presentation, we will talk further into that story. Now let's talk about some of the key concepts of narrative therapy. According to narrative therapy, human beings are storytelling creatures. The practice of sharing stories, telling stories is as old as human civilization. Now the question is how these stories impact us. According to narrative therapy, the story that people tell us or the stories that we tell ourselves build our identity. So our identities are formed by the narratives we are exposed to or the narratives we tell ourselves repeatedly. So what happens if a story is kind of repeated again and again, it becomes sort of, we internalize those stories. And once we internalize those stories, we try to look at the world from that lens. So the stories become sort of lens for us, and we look at the world from those lenses. So these stories becomes a kind of how we interpret the reality around us. Now, so these stories influence the way we think, feel, and behave. Let me share one personal narrative of mine, which will help you understand this point. So growing up, my grandmom, she died 6 months before I was born. Growing up, my mom often used to tell stories of my grandmom. Like one of the stories she used to tell me how when she first came in our home as a newlywed bride, the first thing my grandmom told my mom that whenever you make food, make sure you cook food extra for one person. And my mom was baffled, like, why? And then my grandmom told her, like, you never know, anybody could come at your home anytime, and you can't let anybody go from your home without having food, without sharing food. So so I heard these stories from my father as well sometimes about her kindness, compassion, and love. These stories were narrated to me not only from my family members, but I heard her stories of kindness, compassion from other people in my community. I met one guy a few years ago, and he narrated me another story of my grandmom. Like many years ago, he borrowed money from from my grandmom, and he was too poor to really return that money. So he never returned that money to my grandmom. And my grandmom knew about it, so she never pressurized him to return the money. She never asked for the money because she knew that he doesn't have the capacity to repay the loan. So at that time, hearing these stories, I didn't realize that I'm internalizing it. Now, when I think back, uh, I can see, like, I consider myself right now that I'm a very compassionate person in my own identity. Compassion is a big piece of my identity. And when I look back and ask myself where this piece has come from, I'm sure definitely it has come from those stories I heard from my parents about my grandmom. So the stories that we are exposed to, they influence our thinking, feeling, and behavior. Now, how these stories influence us depends on the narrative. So, according to narrative therapy, a story can be categorized into two categories. One is problem loaded, problem saturated stories. The other is healthy stories or strength based stories. So, how these, so for example, let's say if a client comes to me and he shares that, I'm the black sheep in my family. Now, this person has internalized this story like he's the black sheep in the family, and and he may have exposed to this story maybe many times that he has now internalized it, and now he's kind of interpreting the reality through this lens of like he's different in his family. So these stories, problem loaded stories, they focus more on the problems rather than the successes. So So the person, I just gave an example. If this person has, let's say, a success story or success in doing something, even if that happens, this person is going to say like, uh, you know, it happened because I got lucky, or the success will not last longer, because this person is having trying to look at these things from that problem loaded stories that he has internalized. So life is, yes, life is difficult, life is not fair all the time, but along with these struggles, problems, life also has some bright spots as well. So a healthy story has a fair balance of both the components. And a healthy story or strength-based stories have its primary focus on the strength and successes rather than on the problems. So coming to the question, what brings a person to counseling, or what are the reasons for clients' concern? Uh, According to narrative therapy, a client is stuck in his life in these problem-loaded, problem-saturated stories, and he's unable to move on, and that's what brings him or her to therapy. So now let's talk about the techniques and procedure followed in narrative therapy. The first thing that narrative therapists use, they use a lot of questions. Now, asking question, you may have already noted that is discouraged in therapy, but in narrative therapy, questions have a different purpose. So the questions in narrative therapy are not asked to gather information about the client. The purpose of asking questions is to generate experience, and the questions provides an opportunity uh, to explore various uh, dimensions of the client's life situations. So the questions have a different purpose in narrative therapy, and that is to generate experience, more awareness about the life situation of the client. Another thing about question is these questions are are more kind of developing a curious conversation, a curious and respectful conversation rather than gathering informations. So the clients, the counselor have this stance which is more kind of being respectful, being curious, and being open. The second technique, which is one of the key technique under narrative therapy, is the technique of externalization. Now, what is externalization? So, one of the key premises of narrative therapy is the client is not the problem. The problem is the problem. So the person is not the problem is the problem. So they assume that when the problem and the person are embedded together, it is very difficult for the client to look objectively at the problem and feel more control over the problem. So one key task of the counselor is to separate the problem from the person so that the person can look objectively at the problem and have more control over the problem that he or she is experiencing. How do we do that? So one technique which is often used is naming the problem. So you name the problem. The counselor invite the client to choose a name for the problem. And the moment you choose a name for the problem, it becomes kind of, like a distance between the person and the problem. It creates a distance and externalize the problem from the person. For instance, let's say if I have a client who seeks therapy for, let's say, test anxiety. Now I can invite the client to name this problem. And let's say the client comes up with a name like John. Okay, and I can say like, okay, what was the first time when John knocks at your door? So, and when John knocks at your door one day before the exam, what John tells you? So you see, when you name the problem, it creates a distance between the person and the problem. And the client feels a little easier to look at the problem from a distance. So this is one technique which is often used. Deconstruction, again, it is the same thing, creating this distance and looking at the problem from a distance and try to look at the problem from various angles. So deconstructing the problem that the client is experiencing. Another thing that the counselor uses is counselor looks for unique outcomes. So let's say the same example of this client who seeks counseling for test anxiety. So I can ask the client like, okay, tell me a time when John didn't really knock at your door the night before the exam. Or even if he knocks at your door, he didn't really, bothers you. He was quiet and didn't tell you. So you're not really experiencing the same kind of anxiety that you often experience. So try to look for some stories, some unique outcomes which are different than what the client is experiencing, the usual problem loaded stories that the client is sharing in therapy. And as a counselor, I try to build on these unique stories, these unique outcomes. And how do I do that? After I generate these alternative stories, alternative outcomes, I try to document it. Now, documenting doesn't mean like you just record it. It's more like a story will die if it does not have an audience. So as a counselor, I try to help client to find some audience for this alternative story. The more the client shares these alternative stories with people he loves, people he trusts, people who care for the client, these alternative stories becomes more stronger and more long lasting. One technique that Michael and Epstein developed is the technique of therapeutic letter writing. So what happens in this is After every session, the counselor writes a letter. Now, in that letter, the counselor talks about the work they have done in that particular session. And the focus of the counselor is more on these alternative stories, alternative outcomes that the counselor want to strengthen. So these are the techniques which are used by narrative therapists. Coming to the being part of narrative therapy, uh, relationship is very important in narrative therapy. Uh, how this relationship looks like, this relationship is more, I would say, the Rogerian approach to relationship, where as a counselor you try to create these core therapeutic conditions, and along with using the techniques that we just mentioned in the previous slides. Now, as we already discussed, like in postmodern approaches, since there is no single objective reality, every individual has his own reality. So narrative therapy again has, like, the client is the expert. Client knows uh, his reality. So rather than taking the stance of being an expert in narrative therapy, the counselor is is coming from not knowing stance rather than an expert. So the client is the expert in narrative therapy. Another thing that we talked about is in our previous slide is, since we narrative therapists ask questions, but they ask questions not in a way like, okay, like as an investigator. So I'm not kind of investigating my client. Asking questions comes more from a very respectful curiosity, uh, and with optimism, like, okay, like the client, you focus more on the strength of the client rather than on the negative aspect of the client. So the questions comes from a very respectful, curious stance of the client. Uh, Sometimes some people think that, okay, this narrative therapy approach is more kind of, applying techniques and less about therapeutic relationship. Michael, who is one of the pioneers in developing this narrative therapy, he said it very specifically that therapist way of being is more important than the techniques we use in narrative therapy. So rather than focusing on techniques, the primary focus of the counselor is on having a way of being, which is again, as I talked about, making sure that you create a therapeutic environment having all the core uh, therapeutic conditions. Again, we already talked about the client strength related stories. So when the client comes to therapy, the client comes with this problem saturated stories. So you hear those stories with openness, optimism, with respectful curiosity, but at the same time, you are also focusing on among those problem-loaded stories. You try to find out some of the nuggets which are the client's strengths. So hearing those stories, your focus is on some of the strength that those stories contain. Uh, Also, like other postmodern approaches to therapy, narrative therapy avoid diagnosis. And the reason is again same, like every client, there is no single objective reality. So every client comes with his or her own reality. So that this is the reason why postmodern approaches, including solution focused and narrative therapy, avoid diagnosis or labeling client. Okay, so we are now at our last slide, and if you remember in the beginning of narrative therapy, I gave you one exercise of writing your own story. Now assume you have come up with your own story, which is kind of 3-4 page story. Now I want you to look at the story and think about how you want your story to evolve. Like, you wrote the story, now how you want the story to evolve in the coming months or coming years. Is this the story you want for your life? If not, then I would invite you to rewrite this story, keeping in mind how your story evolves in the coming months and years. Once you have done that, the third step of this exercise is, so this is the story which I want for my life. Now, what actions can I take at this moment to make this story a reality? So you have to think through the steps, the actions, the strategies that you can plan to make sure that this story that you have written gradually turns into a reality. I'll see you in the class tomorrow. If you have any questions regarding postmodern approaches or solution focused or narrative therapy, we'll discuss that in the class. Thank you and have a wonderful rest of the day. Thanks. Bye-bye.